Hello everyone, and welcome to our Leadership Group project. Today, Melissa Reynolds, Michelle Skeens, Taylor Simpson, and Zainab Sabrine will be presenting on Nursing Care of Cirrhosis for the Mount Sinai College School of Nursing. We will begin by reviewing each objective, giving our audience a framework of understanding for the presentation. The student nurses will present a handoff report of the cirrhosis case study, expert guidelines on care based on cultural and spiritual backgrounds, a nursing care plan with a priority nursing diagnosis and corresponding outcomes and interventions, pathophysiology with age considerations using the nursing process, and lastly, home instructions regarding a prescribed medication and safety. And all of these objectives will be accomplished by the end of the presentation. Handoff report of cirrhosis case study. Situation. The patient is a 72-year-old Samoa American male. They were admitted to the hospital last evening for abdominal pain. They were diagnosed with an exacerbation of symptoms related to cirrhosis. Ultrasound confirmed abdominal ascites. A paracentesis was performed by this physician. Verzed was administered for sedation. The patient was placed on MPO status with an order for TPN to support their nutritional intake. Background. The patient has a history of alcohol use disorder, over 45 years, atrial fibrillation, gastroesophageal reflux disease, chronic smoking, and has a BMI of 36. The patient also identifies with the Church of Latter-day Saints, also known as Mormons. Assessment. The patient has pale skin with slightly yellowish hue. Abdominal is full and rounded. The patient also has 3+ pitting edema in his ankles bilaterally. The patient complains of itchy skin, exhaustion, and abdominal pain as a 6 on a scale of 1 to 10. Metabolic panel is being processed to assess electrolytes. The patient's family and friends are not adhering to the one visitor at a time policy. Many of the patient's family members continue to visit as well as the local practitioners. Recommendations. It is important to evaluate the patient's lab results, electrolytes, and paracentesis sample. Assess for fluid and electrolyte deficiencies, specifically sodium and potassium, as they are common with paracentesis procedure. The nurse should educate the patient on the importance of laying on their side post-paracentesis for a minimum of 2 hours. This is essential in order to prevent leakage. If leakage continues over 2 hours, the nurse should contact the physician. The nurse should also communicate with the patient and the family the importance of the visitor's rules and how the highest priority needs to be the health and welfare of the patient's families and staff members. The nurse should also educate the patient on the importance of certain lifestyle changes in order to promote liver health, including no smoking, no drinking.
Next, we will discuss expert guidelines on care, including culture and spirituality for American Samoans. In this group, there are some barriers to open communication, which include limited consultation times, language barriers, use of medical jargon, obtaining closed answers from healthcare professionals, shame in not being able to understand, frustration and anger, and feeling as if you are wasting the doctor's time when they seem in a rush. Having good communication, building rapport between the nurse and the patient, being patient-centered, trustworthy, a good listener, understanding, and acknowledging the patient's values and culture are all components recommended to care for patients associated in this cultural group. These patients are more apt to trust the advice, recommendations, and adhere to self-care instructions when they believe the healthcare professionals respect and understand their culture. There are several cultural values important to Samoan Americans, which are valuable in the healthcare setting. Some of these values include balance, also known as lokahi, family, known as ohana, love and compassion, also known as aloha, and caring, known as malama. The lokahi triangle is a concept they believe in, which includes a combination of physical, mental, and spiritual parts being in harmony with each other. The nurses should spend time with the patient to learn about the origins of their illness and get better acquainted with them. The second value, ohana, meaning family, encompasses how family plays an important role in their lives and illness of one person affects the entire family. It is expected for family members to be involved during any decision-making and care decisions during the patient's hospitalization. Lastly, they want to be respected and cared for if they do agree to get treatment and establish trust in a patient-physician and nurse-patient relationship. For the patient in this case study, the nurse can establish trust, be honest, listen, have open communication, and understand the values and culture. In doing so, the nurse can get to know the patient better and find out what the patient believes the origin of the disease is. In addition, the nurse can discuss with the patient if they would like the family to be involved with their care.
The care plan utilizing the nursing process. The nursing diagnosis is excess fluid volume related to failing hepatic function as evidenced by a rounded abdomen full of fluid accumulation, bilateral +3 pitting edema of the lower extremities, and the patient stating abdominal pain is 6 out of 10. The first outcome and interventions. The first outcome is to reduce abdomen pain from 6 out of 10 to 4 out of 10 by the end of the shift. The first intervention is to administer physician-prescribed diuretics to help reduce fluid pressure on the abdomen by the end of the shift. The second intervention is to advocate for the patient and have the physician submit orders for pain medications by the end of the shift. The third intervention is to encourage non-pharmacological therapy, including music, breathing techniques, guided imagery, and meditation as needed before the end of the shift. The second outcome and interventions. The second outcome is to reduce bilateral pitting edema from +3 to +2 by the end of the shift. The first intervention is to elevate both feet on a pillow to the patient's comfort level and to promote venous return by the end of the shift. The second intervention is to reposition the patient every 2 hours to prevent fluid from accumulating in dependent areas by the end of the shift. The third intervention is to monitor for significant weight change of at least 2 pounds in a day by the end of the shift. Pathophysiology of cirrhosis. Cirrhosis is an advanced stage of fibrosis and scarring of the liver that alters all functions. The cause of cirrhosis can result from various factors including chronic alcohol abuse, hepatitis A, hepatitis B, hepatitis C, autoimmune hepatitis, non-alcoholic fatty liver disease, biliary tract disease, and metabolic conditions including Wilson's disease, alpha-1 antitrypsin deficiency, and hemochromatosis. When chronic injury to the hepatocytes occur, fibrosis and scarring occur. As the fibrosis and scarring advance, cirrhosis sets in. Cirrhosis is an irreversible disease. The signs and symptoms of cirrhosis include jaundice, scleroicterus, spider angiomata, palmar erythema, hypogonadism, nodular liver, splenomegaly, prominent veins radiating from the umbilicus, fluid accumulation in the abdominal cavity, petechiae, purpura, bleeding, finger clubbing, dyspnea, hypoxia, anorexia, muscle wasting, and acute kidney injury. As cirrhosis progresses, complications will present, including portal hypertension, ascites, edema, splenomegaly, bleeding, infections, malnutrition, hepatic encephalopathy, jaundice, bone disease, and an increased risk for liver disease. In the case of the 72-year-old patient, an aging liver can also contribute to the decline in hepatic function, and also having a body mass index of 36 puts the patient at a higher risk for complications. The paracentesis was needed to reduce the ascites in the patient's abdomen. The ascites and bilateral edema of the lower extremities that the patient was experiencing is a result from increased pressure in the portal vein, causing fluid to accumulate in the lower extremities and in the abdomen. Another cause of ascites and edema can also be the result of the liver lacking the ability to make enough albumin a special blood protein.
Medications used for treatment include midazolam and spironolactone. Midazolam is also known as Versed, and it's a high alert medication and a benzodiazepine. It's used for anxiety and also as a sedative or hypnotic before procedures such as a paracentesis. It's given PO, IM, or IV, and the most common side effect is phlebitis at the injection site. However, serious adverse effects may occur, especially with prolonged use. This includes apnea, laryngospasms, or severe respiratory depression. It can also cause cardiac arrest. Signs and symptoms of cardiac arrest include chest pain, radiating pain to the arm or jaw, shortness of breath, dizziness, sweating, anxiety, nausea, palpitations, or loss of consciousness. If any of these signs, symptoms, or conditions are experienced, medical attention should be sought immediately. Spironolactone, otherwise known as aldactone, is an aldosterone antagonist. It's also a potassium-sparing diuretic. It is the go-to choice for the management of edema, including ascites that's secondary to cirrhosis of the liver. Hyperkalemia is the most common side effects, and there are no major adverse effects. Spironolactone may cause electrolyte or acid-base imbalances, and fall precautions should be put into place. Positions should be changed slowly due to possible hypotension, and any balance problems should be reported to the physician. Palpitations, chest discomfort, shortness of breath, difficulty breathing, wet cough, or fainting can all be signs of excessive fluid retention and or hyperkalemia. These should be reported to the physician immediately. Measuring the girth of the edematous area will help to determine the efficacy of the medication.